What have you learned about your career choice of dietetics?
Basically, the definition of being a successful dietitian is someone who studies nutrition and health and how it correlates to the body. Then it helps prevent with diseases and basically having a nutritious lifestyle so that you don't have diseases and sickness throughout your life or whenever you have it now. And it helps you can work in the field of maybe a hospital or in a nursing home or kind of like a counseling thing with families if you want to help children with childhood obesity, and you educate people and also come up with ways to prevent diseases and maintain a healthy lifestyle. And to become a successful dietitian, you have to go to school and get a major in nutrition, and also you need to intern for about a year with a professional dietitian if you want to have your own private practice, so that you have good experience, and it helps basically get good experience to be a dietitian. And then you have to have the registration exam with it's a multiple part exam covering all areas of nutrition and dietetics as well. And then you have to register for a license to be a dietitian in the state required, so whatever state you're wanting to live in or practice being a dietitian in. And the salary is about $56,000 a year. That's like the median. So you can also get more, up to like $65,000 to $70,000 at the very most if you're like really good, get lucky, whatever state you go in. And then also, if you get a master's if you go back to school and get your master's degree in nutrition, it also helps further your education in nutrition. And that's also how you get more money if that's what route you're trying to look for. But basically, it'd be cool to be a dietitian just to like help kids and counsel people on nutrition and just get people back in good health.
And tell me what you've learned about childhood obesity.
Childhood obesity, the immediate health effects are, for obese youth, it's cardiovascular disease such as high cholesterol, high blood pressure, and it says based on a sample, 5 to 17-year-olds, 70% of obese youths had at least one risk factor for cardiovascular disease, and it also leads to diabetes and cancer of colon, esophagus, kidney, pancreas, gallbladder. And those are more long-term effects, but they're still effects based on obesity as being a child. And ways to prevent it is basically focusing on good health, and it's kind of the root of the parent also. They have to educate their kids, give them good portions, try to show them, introduce them to maybe like the food pyramid, something like that, because kids just don't know whenever they're younger. That's what leads to childhood obesity, and lack of exercise as well leads to childhood obesity.
So how will your knowledge on dietetics help with these children with obesity?
Basically, that's like the main root of where I would help out at, because my knowledge in nutrition and health I can help kids and educate families in general, because some parents don't even know about nutrition and health. Basically just help them learn about nutrition, what to get on a good food plan to prevent from diseases so that they don't get cancer or lessen their risk of diabetes when they grow up. Maybe get them on an exercise plan, but with my major in nutrition, I'll learn about the body, food, how everything correlates together, and all that put together will help childhood obesity, because I can educate people with the knowledge that I learned to lead to a more healthy lifestyle.